When taking a person's blood pressure, there are a few pre-assessment protocols to follow. First, you want to be sure the person has been resting with feet flat on the floor with the back support and arm resting at a heart rate level for at least 5 minutes. You also want to be sure blood pressure measurement is taken on the left arm, which should be bare. Therefore, if the person has sleeves or a jacket, instruct the person to remove the jacket or lift the sleeves. Also instruct the person not to intake any caffeine or nicotine at least 30 minutes prior to the assessment. Proper cuff size must be used to ensure accurate measurement. The bladder within the cuff should encircle at least 80% of the upper arm. When placing the cuff, you want to align the artery mark with the brachial artery. Ensure that the stethoscope ear prongs face forward. Place the bell of the stethoscope over the brachial artery. Then you want to be sure to turn the valve to the right, inflate to 180 millimeters of mercury or 20 millimeters of mercury above first quarter cuff sound. Next, you want to turn the valve to the left to release at a rate of 2 to 5 millimeters of mercury per second. Systolic blood pressure is the point at which you hear the first strong quarter cuff sound, and diastolic blood pressure is the point before the disappearance of quarter cuff sound. The person should be allowed to wait 3 to 5 minutes before blood pressure is reassessed. Normal blood pressure is systolic of less than 120 and diastolic of less than 80. Prehypertension is classified as 120 to 139 systolic and diastolic of 80 to 89. High blood pressure stage 1 is a systolic of 140 to 159 and 90 to 99 diastolic. High blood pressure stage 2 is a systolic of 160 or higher and diastolic of 100 or higher. Hypertensive crisis is higher than 180 systolic and higher than 110 diastolic. After assessing each group member's blood pressure, we observed normal range values for 4 out of 5 of the tested subjects. Subject 2, however, tested at a prehypertensive classification.